While not every diabetic needs medication, many people control their symptoms through insulin and oral medication. However, there is a way to possibly reduce or even eliminate your need for medication if you are a diabetic. And so, in today's video, I will be talking about a topic that is on the mind of many people living with diabetes type 2. How do I get off medication safely and still manage diabetes effectively? My name is Mira Bikono, a registered nurse and a certified diabetes educator. I share videos on diabetes awareness and tips to manage diabetes type 2. If you find my content helpful, hit the subscribe button and also put your notification bell on so that you won't miss out on any video. Before we dive in, let me make this clear. This video is not a medical advice and I'm not telling you to stop taking your medications before you go and throw away your medications. No, that is not the point of this video. Always consult with your doctor or your diabetes care team before making any changes on your treatment plan. With that being said, let's get started. First, let's talk about why medications are prescribed in the first place. Type 2 diabetes is a chronic condition where your body either doesn't use insulin properly or it doesn't produce enough insulin. So, medications like metformin or insulin can help to keep your blood sugar levels in a healthy range to prevent complications like nerve damage, kidney disease, or even heart issue. But the good news is that for some people with lifestyle changes and proper management, it is possible for them to reduce or even eliminate their need for medication over time. Mind you, the key word here is possible, and it depends on individual circumstances. The first step to reduce your dependency on medication is addressing the root cause of diabetes type 2, which is insulin resistance. So let's take a closer look at what insulin resistance is all about. Insulin is like a key that helps sugar or glucose to enter the cells to be used for energy. But when your body becomes insulin resistant, the key stops working properly. So your cells no longer respond well to insulin, forcing your pancreas to produce even more insulin to keep blood sugar levels normal. Over time, this overwork can exhaust your pancreas, leading to high blood sugar and then pre-diabetes and eventually type 2 diabetes, which is the state in which we are right now. The typical causes of insulin resistance are excess weight, especially belly fat, which triggers inflammation in the body. Lack of exercise, which reduces insulin sensitivity. We also have unhealthy diet, that is too many processed carbs, sugar, and unhealthy fats. All these contribute to insulin resistance. Genetics and family history is another cause of insulin resistance. So if diabetes runs in your family, you are at a higher risk of developing insulin resistance, which can also lead to diabetes type 2 if not put under control. We also have chronic stress and poor sleep. These increase cortisol, making insulin resistance even worse. Common symptoms of insulin resistance include constant fatigue, especially after meals, frequent craving of carbohydrates or sugar. We also have weight gain, particularly around the belly area. Dark patches on the neck and armpits is also another symptom to know if you are insulin resistant. And finally, we have increased hunger even after eating. Now that we know what insulin resistance is, its causes, and also its symptoms, let's talk about how you can tackle it with lifestyle changes and get off your medications. Remember, to treat diabetes effectively, you have to tackle its main cause. And here is how to do it. We are going to break this down into 4 main areas, that is your diet, exercise, weight management, and finally, we are going to talk about stress reduction. The first point is diet. So focus on diabetes-friendly diet. This is very important. What you eat plays a major role in managing your blood sugar levels, and so switching to a balanced whole food diet can make a very big difference. Here are some tips to take into consideration. The first thing for you to do is to reduce refined carbohydrates and sugar. For example, swap white rice for brown rice or millet, and also replace sugary snacks with nuts, seeds, or even Greek yogurt. The second thing for you to do is to prioritize fiber-rich foods like leafy green vegetables, beans. Whole grains slow down sugar absorption and keep you full longer. Number 3 is for you to eat healthy fats and protein. Add avocados, nuts, fish, lean meats to your meals to stabilize your blood sugar levels. The fourth thing is portion control. Even healthy food can cause high blood sugar levels if you eat them in large quantity. For example, let's say you love jollof rice. Instead of eating a big plate of jollof rice, try a small portion and pair it with a lot of vegetable. Add some grilled fish or chicken. This way, you will reduce the glycemic load of your meal. The second thing to do for you to get off your medication is regular physical activity. Exercise is another great way to get off your medications when managing diabetes. It is another game changer. So, physical activity helps your muscle to use glucose more effectively, and as a result of this, it reduces insulin resistance. You don't have to start running a marathon. Begin with small, consistent changes. Walk for 30 minutes a day, 5 times in a week. Try strength training with light weights or even body weight exercises. Dance, swim, or play a sport that you enjoy doing. One of my patients started with just 10 minutes walks after meal and saw their blood sugar levels drop significantly within weeks. So you see, small steps lead to big changes. The third way for you to get off those medications is weight management. Did you know that losing even 5 to 10% of your body weight can have a dramatic impact on your blood sugar levels? For someone weighing 90 kilograms, that is just 4.5 to 9 kilograms. A combination of healthy eating and exercise usually helps with weight loss. Remember, it's not about quick fixes. Slow and steady wins the race. The fourth way for you to finally get off those medications is for you to put your stress under control. Stress hormones like cortisol can spike your blood sugar levels, so find ways to relax. Practice deep breathing or meditation. Take up a hobby that you enjoy doing, and also make time with your family and friends, for this is very important to reduce your stress level. As you work on these lifestyle changes, it is very important to regularly monitor your blood sugar levels. Keep a journal of your readings, meals, and activity. This will help you to understand what works for your body and what doesn't, and then you can easily make adjustments. Now, here is the most important part. Always work with your doctor or diabetes care team. If your blood sugar improves consistently, they might gradually reduce your medication. For example, your doctor might lower the dose of metformin if your A1C levels drop below 6.5% and stay stable for several months. Remember, stopping medication without medical guidance can be very dangerous to your health. The reality of getting off diabetes medication is that not everybody can or should get off medications completely, and that's okay. Factors like genetics, how long you have had diabetes, and other health conditions play a role. The goal is to manage your diabetes effectively, whether that is with medication or without medication. Let me share a quick story. One of my patients, a 50-year-old woman, started her journey to reduce her medication. She switched to a low-carb and high-fiber diet, began walking for 20 minutes every evening, and lost 8 kilograms over 6 months. With her doctor's guidance, her metformin dose was reduced by half. Her journey wasn't about perfection, it was all about consistency. And that's the key takeaway for you. Small, sustainable changes lead to big results. Getting off type 2 diabetes medication is possible for some people, but it requires commitment, consistency, and collaboration with your healthcare team. Focus on improving on your diet, staying active, managing your weight, and reducing your stress. And most importantly, celebrate every small win along the way. This will help to keep you motivated in your journey with diabetes. If you found this video helpful, don't forget to give it a like, share, and subscribe to the channel for more practical tips on how to manage diabetes type 2. Remember, you are not alone in this journey. We are here to help you in every step. Thank you very much for watching, and I will see you in my next video. Also, check out these videos on the screen for more tips on how to manage your diabetes.